Okay, first I can ask, how is she feeling? What is her name?
Okay, her name is Zainab Musa.
Okay. And how is
Did
she
you,
feeling
did you get the
today?
name?
Can you say it one more time?
Yeah, yeah, Zainab Musa.
Zainab Mosa.
Yes.
Okay.
The Musa is Musa.
Okay, MUSA. Okay.
Musa. So if you remove the M, if you remove the M, it becomes United States of America already.
It does, yes.
Isn't it? Yes.
Yes. Okay.
So, and if you just remove that, and that's your country. Are you from? Okay, yes.
Yeah.
So she's Zainab Musa.
How is she feeling today?
She's feeling much better
Much better.
from the treatment she has received so far.
Okay. So is she
Okay.
showing?
Yes.
Is she showing any like symptoms of anything? Any sign?
Yeah. Are you talking about now or initially when she came?
Um. I guess now.
Okay. So you want to diagnose her from now, or you want to diagnose her from the time she came with her symptoms? Which one?
Let me ask the doctor. Doctor? Are you here?
Yes.
Should I be diagnosing her now or from her initial
Have
time?
whatever you think that you're comfortable with, it's okay. All right. So
Okay.
just go through the symptoms inside, investigate,
Okay.
and whatever you think.
Okay, because the doctor's telling me that she's already like recovered.
All right. So you can ask him what the problem was before she recovered.
Okay, so what was the problem before she recovered?
Yeah. So that is a good question because okay, you should have just talked to me till I could have led you to what to really ask. You understand? So it's better to ask a patient what brought her to the hospital initially before she's even getting better now, isn't it?
Yes.
Yes. So she presented with headache, abdominal pain, fever, loss of appetite,
Okay.
some diarrhea. Yes.
Okay. And did you take any diagnostic tests?
Yes, we did.
Okay. Did you take?
So yeah.
Did you take a culture?
Yes, we took a culture.
Okay. What did the culture show?
Yeah, the culture said it was positive.
Positive. Okay. So is she like tender in the abdomen region?
Yes, there's tenderness in the abdominal region.
Okay. Is her fever, was it continuous?
Yeah, the fever was continuous. I like the way you're going about it. You know what you're doing? You're like, you're doing what we call history of presenting complaints, which is a very good thing. And that's what doctors do.
Okay.
So that's a good one. Yes.
So, do you remember what her temperature was when she came in initially?
Yes. So are you familiar with the degree centigrade or degree Fahrenheit?
I'm familiar with Fahrenheit more.
Fahrenheit?
Yes.
Yeah, so the temperature for the degree Fahrenheit, it was 97.9 degree Fahrenheit. 97.9, yes.
Okay, and that was initially?
What did you say?
Was that initially or is that now?
That was initially because okay, were you wondering about the temperature?
Excuse me?
Were you wondering about the temperature?
So, usually for a fever above 99.5, that's considered
Yes,
fever.
yes. It's a good question you're asking this. I think you're going to be the first person to ask this question. So let me tell you why.
Okay.
Yeah. When it is an acute thing, when something comes acutely within a few days that you'll be having the symptoms, you expect to have a very high fever, isn't it?
Yes.
The temperature be high, it's going to be more than 99 and all that. But by the times, the patient is not present on time, the immunity must have, the body system must have mounted some immunity, and one way or the other, the temperature begins to like calm down, it fluctuates, even though it's supposed to be continuous, but it fluctuates. So at the particular time the patient will come, you may find the temperature normal.
So only the temperature.
But that does not mean, yes,
It's
yeah.
usually
But by the time you
acute.
touch the patient, yes, yeah. By the time you touch the patient, you find that yes, the patient's body is hot, but the temperature reading, may not really be what you are thinking of.
Yeah.
You may be thinking, you're supposed to have something more than 99, but then you say, no, it's just 97.9 now. Like, okay, then is when you now investigate your patient that finally get what you want.
Yeah.
Yes.
So what matters is her history of the fever.
Yes, yeah, the history. History takes about 80% of your diagnosis. Do you know that?
Yeah, that makes sense.
So, yes, 80%. Investigations. The examination may take maybe something like 15%, and then your investigations you do are just to confirm your diagnosis.
Okay. Yes.
So if you want to be a good clinician, just like the way you're doing, is to take a good history from your patient, examine your patient very well. They make a diagnosis and they request for your investigations, just like what you did, asking for a blood culture, which came out to be positive.
Mm-hmm.
So, what do you do for your patient? What are you going to do for your patients?
Well, actually, I'm going to ask just a few more questions just to rule out some other
Yeah.
diseases.
I know. Do you know one thing is like, you see if you're already a doctor, kind of.
Thank you.
I know, because the way you're going about things, I'm really happy with you. It's like doing great. It's something you're kind of the best. I'm coming across now, and I'm overwhelmed. With joy that the way you're going about your clinical scenario, and that's really good. So you need to ask about other things, and that's what we call differential diagnosis. So continue. Yes. What other things do you want to ask?
So has she had any coughing that's persistent?
Yes. There's no cough.
No cough. Okay.
There's no cough.
No runny nose.
Yes.
No sore throat.
No sore throat.
Okay. So there's probably no reason to get a chest X-ray if there's nothing that pertains to the chest.
Yeah, because you know why? If you're going to do chest X-ray for somebody who's not coughing or doesn't have any respiratory infection, you're exposing the person to ionization radiation.
Yeah, that's not
unnecessary. Yes. It's unnecessary. It's not good for the patient,
Yeah.
So that's why your clinical acumen has to be good.
Yeah. Okay, that makes sense.
So that you don't subject patients to unnecessary investigations. Yeah. So continue.
Okay. So also just to rule out maybe malaria or something. She hasn't presented with extremely high fever, then off on and off kind of fever.
Yes.
So
yeah, okay, let me say something here. In Africa, more especially Nigeria, malaria is endemic, isn't it?
It is endemic, yes.
Yeah. Let me tell you something. You may just see the patient, you touch the body and it's not hot, but you do a malaria parasite test and it comes out to be positive. So what do you say about that?
Excuse me, can you say that one more time? The last part?
Should I say it again?
Yes, please.
Yeah. I said that, here in Africa, more especially Nigeria, where malaria is endemic.
Yeah.
You get what I'm saying?
Yeah.
Somebody will come tell you that, man, I'm feeling weak, having headache. Is your body hot? You say, well, occasionally it's hot. Then you do a malaria parasite test and it comes out to be positive.
Yeah, the blood smear, correct?
Yeah. Would you be surprised?
Not really surprised.
Yeah, you shouldn't be surprised because malaria is endemic here. You don't expect people to have high fever. It's just so common. Like you, for example, if you travel down to Nigeria and you have some mosquito bites now, I'm telling you, come with high fever. Your temperature may be reading 100 or something degree Fahrenheit.
Yeah.
So that's it. Yes. So it's just that because you don't have prior immunity to malaria.
Okay, so
like me now, let me tell you something. I can be feeling weak and all that, but if you do my blood test, now you see malaria.
Yeah. So did you do a blood smear for any
malaria? Yeah.
And it did.
Yeah, we did. Yes, we did.
And it did come back positive.
It came out positive.
Okay, so the culture and the blood smear came out positive.
Yeah, trust me, both of them came out to be positive. Yes.
Okay, so I'm gonna check one more thing. Did you check her hemoglobin?
Yes, I checked the hemoglobin. Yes, it's 12 gram per day.
Okay, so that's normal. That's not
Yes,
bad.
that's not. Yes, yes.
Okay, so now right now what I'm thinking is like between malaria and maybe typhoid.
Okay. You don't maybe it anymore because it's already positive, so it's actually typhoid.
It's
You
typhoid.
know,
Okay.
but dude, yes, okay. For the malaria, it was just some little pluses. It depends on the plus. By the time you say plus one, plus two, plus three, you're
Okay.
talking about the severity of the malaria. Yes.
So it's not
So it turned
severe.
out, yeah, it turned out to be plus one. It wasn't severe, so we have more of an typhoid than malaria in
Typhoid.
this case. Okay,
Okay.
yeah. So more of typhoid than malaria, but of course, you need to still treat both of
Yes.
them. So continue. Okay,
So for the treatment, what I would do is I would give IV antibiotics,
that's good.
and hopefully the patient would practice more, better sanitation, better,
Okay,
um, to prevent any more, complications with their
okay.
disease. Um,
Mm, okay.
um,
So what are the preventive measures
just
for the typhoid? You
make
want to
sure.
let your patient know. So let me give you a guide. You understand?
Yes.
You know how you contract typhoid is anything that goes through the mouth.
Mm-hmm.
It could be something sweet, it could be something solid. So if you can look at the preventive measures along that line, you begin to pick a lot of them.
Yeah. So definitely, if it comes from like things made from the mouth or like ingested in the mouth, you could
Yes,
like you know make sure what you're eating is clean, safe to eat, or else
yes,
because
yes,
that could be a really probable reason why they may have contracted typhoid.
yes, yes, yes,
So, so make sure that the food is safe, reliable, and does not have
yes.
any
Any form
bacteria.
of contamination, yes.
Yes,
Any bacterial contamination, yes,
and make sure like that washing hands, proper sanitation is
yes.
taken
Okay,
so that you don't contaminate yourself. Like you don't contaminate anything that could possibly
yes,
um,
yes.
affect that.
Yeah, so in essence, what you're trying to say is that you need to wash your hands before and after food.
Yes, yes, exactly.
That summarizes it, isn't it? Yeah.
Yes.
So good hygiene, as you said. So,
Okay.
so you've done excellently well.
Thank you, thank you.
Yeah, that's good of you. So I believe by the time you go into the medicine proper, you do more than this.
Okay. Thank you so much.
It's already shown you. Yes. Yeah, I'm so grateful. Nice meeting you.
It's nice meeting you too, doctor. Thank you for this
Yes.
opportunity.
Yeah.
I learned a lot today.
Yeah.